So first of all, you should know like the components of extrahepatic biliary apparatus. See, this is one of the lobe of the liver. This is the right lobe and this is left lobe. This area is actually porta hepatis, which I have explained you when we were doing visceral surface of liver. So right lobe we have right hepatic duct coming. From left lobe we have left hepatic duct coming. Right and left hepatic duct is joining to form common hepatic duct. So this common hepatic duct will carry the bile juice. Via cystic duct it is now carried to the gallbladder. So that means bile juice is stored in the gallbladder. So whenever fatty food is entering into the duodenum, this is duodenum, this is pyloric part of the stomach and this is duodenum. So when fatty food is entering into the duodenum, you will see this gallbladder will contract, the bile juice will enter into cystic duct. From this cystic duct, it is joining the common hepatic duct. Both of them are now forming common bile duct. So this dotted line, whatever area has been shown, this is the common bile duct, which is going behind the first part of the duodenum. That's why it is shown in dotted line. It is going behind the first part of the duodenum, then it is going within the substance of pancreas. It is joining the pancreatic duct. So to form hepatopancreatic ampulla of water or water, then it is opening into the second part of duodenum. So this is the complete course of the common bile duct. Okay, a part of it is seen behind the duodenum, a part of it is seen within the pancreas, and a part of it is seen in the second part of the duodenum. Okay, so hence it is named retroduodenal. Behind duodenum is retroduodenal. Then we have infraduodenal. Infra means below. Below duodenum, infraduodenal. And a part of it is opening in duodenum. You call it as intraduodenal. Okay. So like that, now we are asked this part only, common bile duct, course and relations. See, again I'm repeating, liver is not shown, right and left hepatic duct, common hepatic duct. From here, the bile juice goes via cystic duct to the gallbladder. Isn't it? From the gallbladder, whenever we eat fatty food, the bile juice is entering into the cystic duct. It is joining the common hepatic duct. Both together, you call this lengthy tube as common bile duct. So in the previous picture, we have seen the relations, like it is going behind the duodenum. Retroduodenal, infraduodenal, intraduodenal. So this common bile duct will be joining pancreatic duct. So both of them, when they join, you call like hepatopancreatic ampulla. Ampulla means bulge. Ampulla of water, which is opening into the second part of duodenum. This whole tube is duodenum. It is opening in the second part of the duodenum, and here there will be a valve. Okay, this opening is guarded by an opening. The name of opening is major duodenal papilla. Major duodenal papilla, it will be guarded by a valve, so that when fatty food is entering, then only you will see the bile juice will be allowed to enter into the duodenum. Okay, so now uh, common bile duct. So we are asked like common bile duct, it is 9 centimeters long and it has three parts. Supraduodenal is above duodenum. It is from the free border of lesser omentum with hepatic artery. So that means a very small part. Retroduodenal, I told you it is behind the first part of the duodenum. Pancreatic part can be also called as infraduodenal, below the duodenum, lying between the pancreas and the second part of the duodenum. Intraduodenal, I said it is the one which is entering into the second part of the duodenum. So what is ampulla of water? Common bile duct is joined by main pancreatic duct before it opens into the duodenal papilla. So here I told you we have a sphincter. The sphincter is actually called as Oddi sphincter, sphincter of Oddi. Okay, so this is major duodenal papilla. Here we have a sphincter. Okay, so this is common bile duct, this is pancreatic duct. Both of them are joining to form hepatopancreatic ampulla of Vater, okay, which is opening in the second part of the duodenum. Okay, different pictures are shown. Coming to the blood supply, overall extrahepatic biliary apparatus, it is supplied by cystic artery, which is a branch of right hepatic artery. Venous drainage, it goes into portal vein. Lymphatic drainage goes to cystic group of lymph nodes and hepatic and celiac nodes. Okay, nerve supply. Always remember, for abdominal visceral organs, parasympathetic is vagus, sympathetic is celiac plexus. One word you write. Parasympathetic, vagus, sympathetic, celiac plexus. Okay. So conditions like clinical anatomy, we may find gallstones may get impacted into this common bile duct. We have studied about obstructive jaundice when we were doing biochemistry. So obstructive jaundice is caused due to the obstruction of common bile duct anywhere in its course. Okay, so that is all about common bile duct. Psoas major muscle origin insertion. Okay, I'll show you the muscle and then we will discuss. And then we have common peroneal. Okay. Psoas major. Where do we see psoas major? As you can see, this is the muscle what we see in the posterior abdominal wall. From the posterior abdominal wall it comes. So from where is it coming? From the transverse processes of T12 to L4. Okay, T12, L1, L2, L3, L4. Okay, and you can see the insertion is going to the lesser trochanter of the femur. Okay, lesser trochanter of femur. Then action is, it is the flexion. It brings about flexion in the hip joint, and nerve to psoas major will be derived from the lumbar plexus. You can see exclusive pictures like this. See, this is one psoas major picture, T12, L1, L2, L3, L4, transverse processes of these vertebrae. And you can see the psoas major is passing through the pelvic cavity and then it is getting inserted into the femur. Okay, so that is the lesser trochanter of the femur. Okay, iliopsoas tendon, iliacus and psoas major, both of them will join like this. Okay, so that is about iliopsoas, the psoas major muscle. Then I'll take you to the next answer. I'm just sharing a picture of this common peroneal nerve. I hope everybody is able to see this picture of common peroneal nerve on the screen. Please confirm.
Yes, ma'am.
Huh. So see here, basically sciatic nerve is coming from the gluteal region below piriformis. So this sciatic nerve is running in the posterior compartment of the thigh. Okay. So in the posterior compartment of the thigh, you will see the sciatic nerve is dividing into two in the popliteal fossa. I already told you this point. Sciatic nerve divides into two terminal branches. Medially we have tibial nerve and laterally we have common peroneal nerve. So this common peroneal nerve's further course we have seen when we were doing some topic day before yesterday's class only, I remember. Now see here, what happens to this is, now this common peroneal nerve is seen in the lateral side. It is coming on the lateral aspect of the leg and it is dividing into two. The common peroneal nerve divides into deep peroneal nerve, which is also called as a deep fibular nerve, and we have superficial peroneal nerve. So the superficial peroneal nerve supplies the lateral compartment of the leg. What are the muscles we have studied day before yesterday? Peroneus longus and peroneus brevis. So this superficial peroneal nerve, it is going and supplying the peroneus brevis and longus, and later on it becomes cutaneous like this. This is the superficial peroneal nerve, which is forming medial dorsal cutaneous nerve and lateral dorsal cutaneous nerve. And whatever gray area you are finding here, this is all supplied. This is the cutaneous nerve supply of superficial peroneal nerve. So this is the story of superficial peroneal nerve. Now when you talk about deep peroneal nerve is going into the anterior compartment of the leg and it runs between the muscles of anterior compartment. So what are the various muscles we have in the anterior compartment? We have tibialis anterior, we have extensor digitorum longus, extensor hallucis longus and peroneus tertius. Okay, so these are the four muscles. So this nerve will be running between these four muscles and then it will be supplying all these four muscles. So once it is supplying all these four muscles, later on this also becomes cutaneous. You will see it is supplying the interdigital area, this yellow area, whatever we see. So this is actually the area which is supplied by the deep branch of like deep peroneal nerve. Okay, so we have only this available picture to make you understand. So I told you common peroneal nerve is one of the terminal branch coming from the sciatic nerve. Root value is L4, L5, S1, S2. So it is dividing into superficial and deep branches. Superficial supplies the lateral compartment and deep branch supplies the anterior compartment muscles of the leg. List out those names and draw this picture. And suppose if this nerve is damaged, suppose if the neck of the fibula is damaged, if it is fractured, then it will lead to a condition which is called as foot drop, because the extensor function of the like leg will be lost, and you will see there will be a condition which is called as foot drop. Okay, if the picture is available, I'll show you. It's not okay. Foot drop, I'll show you some other time if you want. Okay. Bones. Now, according to the position, we have now according to the position, we have axial bones and appendicular bones. I'll show you. According to ossification, we have membranous bones, cartilaginous bones. Membranous bones are the bones which ossify in membrane, like skull bones. Cartilaginous bones are the bones which will have initial cartilaginous framework in which bone is formed, like femur, humerus. Membranocartilaginous is a combination of, like that means clavicle like bone, a part of the clavicle is ossified in membrane, a part of it is classified in the cartilage. So according to the shapes, we have long, short, flat and irregular bones. Okay. Now see here. So appendicular skeleton means the skeleton which is present with upper limb and lower limb. Okay, that is appendicular skeleton. Axial skeleton means the skeleton which is present in the midline. Okay, so that is one way of classification you have studied. Axial bones and appendicular bones. Axial bones are seen in the vertebral column and whatever bones associated with the vertebral column. Appendicular bones are upper limb bones and lower limb bones. Okay. Then classification of bones based on shape. If the bone's length is long, you call them as long bones, like humerus, femur, they come under long bones. Any long bone, it has upper end, lower end and shaft. Then we have short bones like carpal bones we have, isn't it? Then we have flat bones like skull bone is a flat bone. Okay, then we have irregular bones like vertebra is one of the irregular bone. So long bones, example femur, humerus. We have like type of long bones also. Typical long bones are femur, humerus. Miniature short long bones like we have metatarsals and metacarpals. They also have upper end, lower end and shaft, but they are small in size. Okay, they are miniature or short long bones. Modified long bone like clavicle and body of vertebra, they fall under the category of like modified. Short bones are these carpal bones. You can name them if you remember. What are the names? Scaphoid, lunate, triquetral, pisiform, isn't it? Trapezium, trapezoid, capitate, hamate. So whatever you remember, you can write. Okay, these are the short bones. Flat bones we generally find in the skull bone. You can write like what is this bone? We have frontal, parietal, temporal, occipital. Anything you can write. Okay, so irregular, like these are the various skull bones which look flat. Okay, then irregular bones, you can take vertebra and also hip bones. We have certain bones which are filled with air. We have taken the details already about this maxillary air sinus, isn't it? Frontal bone with frontal air sinus, ethmoidal bone with ethmoidal air sinuses, sphenoid bone with sphenoidal air sinus. Okay, so they are all actually coming under like air filled bones. Okay, then we have a sesamoid bone which is developed in tendon. So best example of sesamoid bone is patella. So basically when you look at sesamoid bone, it will not have an outer covering, that is periosteum. Usually we, in case of histology of bone, we will see Haversian system, that is also missing. Usually it ossifies after birth. Example, patella, pisiform, fabella. Functions of sesamoid bone, it resists the pressure, it minimizes friction, it alters the direction of pull of muscle, and it also maintains local circulation. Okay, so that is more than enough better. So after that, histology of pancreas I'll show you. So in histology of pancreas, see if you just look into the pancreas slide, it is basically both exocrine and endocrine gland. So the exocrine part will have lot of acini and the endocrine part will have islets of Langerhans. So when you are drawing the exocrine part, you draw like this. These are all acini, acini, acini. Okay, that means you are finding all like pyramidal type of cells. Nucleus is there towards basement membrane, and towards the apex we have zymogen granules which are rich in enzymes and which will be released towards the ducts. So all these are exocrine pancreas, where you are supposed to draw many acini. Cells have spherical basic basal nucleus, and the nucleus is like cytoplasm is basophilic in nature. It has rough endoplasmic reticulum, mitochondria, Golgi apparatus. These dots, whatever you are seeing, those are zymogen granules. Okay, and these cells are actually called as centroacinar cells. Okay, so once you draw exocrine part of pancreas, we should also know the endocrine part of pancreas. The endocrine part of pancreas is basically made up of islets of Langerhans. So these islets of Langerhans will have alpha cells, beta cells, delta cells. These cells are specialized to secrete various hormones, like alpha cells will release glucagon, beta cells will release insulin, and delta cells will release somatostatin. So these hormones are actually maintaining the blood glucose homeostasis. Okay, beta? So that's what you are supposed to draw for pancreas. Okay, so that finishes almost all the questions. Embryology part I will do later. Okay, so we will stop here and I will be sending link for the next paper, physiology. Okay, so I'm stopping here.